Hi, good morning, everybody. Probably we wait for another few minutes to allowing for others to join. Then later on, Prof Lam will introduce Prof Carroll. I think, Prof Lam, we can start. Prof Carroll.
Okay, I'm ready to start. Prof. Carroll, is that all right with you?
Very good.
Okay, good. Good morning. Hello, everyone, and good morning to you all, those in this part of the world, and good evening, Prof. Carroll. We thank you for giving your evening up for us. We're so glad to have you here. So, Prof. Carroll is a professor of physiology at the Brody School of Medicine at East Carolina University. He is also an associate dean for medical student education at the same university. His passion lies in teaching and doing research. Indeed, he is a highly decorated educator, and he has received numerous prestigious teaching awards that included the Robert J. Glasser Distinguished Teacher Award from the Association of American Medical Colleges, the Master Teacher Award from the International Association of Medical Science Educator, and last but not least, the most prestigious of all, I think, the Arthur C. Guyton Physiology Educator of the Year Award from the American Physiological Society. So for those of us who are physiologists, will know a lot about Arthur C. Guyton. I think we grew up with his work through the years. So this morning here in Malaysia, Prof. Carroll will take us through the process of designing effective exam questions and will provide us, hopefully, with a practical guide for the task to help us in our daily life, in our academic life, to make very good questions. So with that, over to you, Prof. Carroll.
Selamat pagi. Thank you very much for the introduction, Professor Lam, and to everyone for taking time to join me today on the seminar. I'm very fortunate to have the ability to make friends from around the world, and Professor Cheng is indeed a good friend and has created very good feelings toward Malaysia within me. So my topic today is going to be how to improve examination questions. So as we go through, I've got the subtitles working to translate my talk into Malaysian. So my Bahasa is not very good, and this is an attempt to overcome some of the language difficulties as we talk about the topics. So for each of the sessions, any educational activity, it's important to have outcomes and the take-home messages. And the ones listed here are the same ones that were listed in the promotional information that was sent out with the flyer. So at the end of the talk, we'll revisit these and see how well we did in achieving those outcomes. One very useful conceptual tool that's helped me organize my teaching is the concept of an educational triangle, in which you can look at what the objective or the expected outcome of the activity is, what the activity itself is, and finally the assessment. As an instructor, I always focused on the objective and the activity, but I did not give enough equal weight to the assessment. In doing that, I was not as effective an instructor. So it's important to realize that you need to focus on the assessments to enhance your teaching ability, and that each of these three things is equally important. So the framework for our talk is within the United States, our accrediting board, the LCME, has formalized the shift to competencies around 2010. So the presentation will talk about the lessons learned at our medical school as we implemented assessments aligned with competency-based education. I would like everyone to take a minute and a half and review this question and see what they think about the question. So read it and see what answer you would like to have to address this question. So this is a practice question that the group that accredits our medical students, the USMLE, has put out. As you look at this, the answers are difficult to initially get to until you decide that the patient is exhibiting the signs of pulmonary edema. Once you've figured that part out, then the question becomes a little more straightforward and easier to answer. And as we're looking at the role of artificial intelligence in impacting education, the AI model correctly answers this question. The right answer is D. The gas exchange at the lung is impaired, so the pulmonary or the partial pressure of oxygen in the arterial blood will be lower than normal. So let's use that as the framework for what is a multiple choice question, and let's talk about the components of a question. So here we have a deficiency in the production of what hormone will impair the production of a concentrated urine, and you have 5 choices. The top part of it is called the stem. The stem should end in a question mark. The choices, 5 choices, are available. One of those is a correct choice, and the other 4 are called distractors. When you're writing a multiple choice question, the true power of the question comes from the quality of the distractors. Initially, when I started writing the questions, I would focus on the stem because I was interested in what I wanted to teach. But when you do the item analysis and review the item analysis, you end up with a better appreciation that it is the distractors that are the most powerful component in the multiple choice question. So, guidelines for developing question. The question has to focus on an important concept. The stem must pose a clear question. You should avoid negatively phrased stems because they tend to separate students based on their language facility rather than their knowledge fund. You should also avoid technical flaws such as grammatical cues or numerical cues when writing the question. So in terms of focusing on a clear, important concept, if I were to ask you which of the following does not belong in this group, if you're online and can answer in the chat, that's acceptable. If not, talk to the person beside you and indicate which of these you feel does not belong in the group. Okay. So in the chat, Crocodile C is emerging as the crowd favorite. I'm going to submit to you that if you were in kindergarten and just learning your alphabet, lion would be the one that did not belong because it begins with an L and the others begin with a C. If you're a biologist, crocodile becomes the outlier in the group. If you're out camping and surviving, a cat would be the one because the other three are capable of hurting you. Finally, if you were a geographer, the cougar is the only one of these four that is found in the North and South America. The others are found through the Asia, Eurasia, and African continents. So this question fails the quality control aspect of it did not identify what the concept was. So on what basis did you try and identify which of the following does not belong in the group? So for developing your distractors, you should use believable distractors. They should incorporate common student errors. You should avoid technologically phrased distractors. Use familiar but incorrect phrases. And one thing that our students have a particularly hard time with is a true statement that does not answer the item is not a correct answer. You should avoid the use of humor in the questions, and the answers should be homogeneous. That is, same length, same category, all should be numbers if the answer is expected to be a number. In terms of evaluating the distractors, someone has to select it or the distractor did not do its job. Its role in the question is actually to distract the student. A distractor is not performing well, it's performing poorly if only students who score overall in the top quarter of the examination select it. A distractor is performing well if the students who are scoring overall in the bottom quarter select that choice. And the best one is one where only the students who perform in the bottom quartile overall on the examination select it. So when looking at the distractors, it's possible to stratify them based on something that's clearly wrong on the left and something that's clearly correct on the right. Generally, you've got a group of answers that are clearly wrong, and then there'll be one answer that's sort of correct, but not completely, and then one that is completely correct. This one is the one that gives our students the most trouble because they go, well, this might be good, but the choice is to choose the best answer. We recommend that when our students look at this and they narrow their choices down to two choices, that they go back and look in the STEM for a cue that is going to eliminate one of the options. You can take the same piece of information and test it as a fundamental knowledge, a pharmacology, or an applied, a clinical application. So if you're just interested in testing facts, you have a drug, which of the following dephosphorylates acetylcholinesterase? And the right answer is D, prolidoxamine. And I've got it in a slightly larger font so I can pick out the right answer when I'm running a workshop. This is pure memorization. No understanding if the students memorize this particular fact, they got this question correct. If they didn't, no amount of thinking about it is going to move them any closer to the right answer. The trouble is, if you give this question to someone who's out in clinical practice, this would represent a barrier. They would have a harder time answering this question. You can take that same fact and rephrase it as a basic science mechanism question. So reactivation of the cholinesterase shortly after exposure to an organic organophosphate insecticide can be accomplished with, and it is still the same question. The correct answer is still D. But now it's testing the mechanism of what's going on with this question. Finally, you could focus this as a clinical task. So a 32-year-old farm worker arrives in the emergency department following accidental exposure to an organophosphate. Atropine is administered to relieve the parasympathetic symptoms. What drug would then be administered to reactivate the cholinesterase? In this context, practicing clinicians are able to get the answer correctly. They may not memorize, they may not be able to know it as an isolated fact, but they know this is the next step they would take in treating a patient. It is still testing things at a fact level. If you do not know this individual fact, you would not get this question correct. Our licensing exam, the USMLE, has an order of information that they require all item writers to follow, and it follows the pattern of a clinical encounter. The first item is a presenting complaint. This is going to include the age and gender of the patient and the presenting complaint along with the nature and the duration. The next piece following this is the history, any recent, past, or relevant family history. The next set of data is going to be the results from a physical examination, then laboratory studies, imaging studies, and finally biopsy studies. So this is the sequence of events with which information comes to a clinician as they're evaluating a patient, and they want to make these examination items as close as possible to the clinical scenarios. When looking at the role of examination items, you've got a whole bunch of examination items. Those together are going to fill into examinations. And so this will be one examination within the curriculum. The examinations then determine how the curriculum is assessed. So assessment versus evaluation, and this phrasing, these definitions are different in England than they are in the USA. In England, they use the exact opposite definitions, but in the USA, we say assessment allows you to make a measurement, where evaluation is interpreting that measurement. And I'm going to use that definition for this seminar. So the reason why you have to have high quality examinations is that the examinations have high stakes. There are consequences to them. They're used to determine course and block grades. They're used to determine whether students can remain in school. They're used for academic advancement and graduation. And the US, the performance on the examinations is used for a competitive ranking of the students within the school. So you must have confidence in your evaluation. And that confidence means the evaluation must be valid and reliable. So reliability is the degree of consistency of a measurement of the technique. So it's the degree to which we would obtain the same result if we were to repeat the examination. So if you would give the test, and then you would give that same test 2 or 3 days later, you would get the same outcome. The degree of measurement error is going to show up in a set of test scores, and that in an item analysis is going to be identified by the coefficient alpha or the Cooter-Richardson 21. And those are statistical measures of reliability. So if you look at somebody out golfing and they're putting on the green, they're trying to get the balls into the hole. This performance is an example of something that is reliable, but not valid. That is, every time you tested the process, you got this reproducible result. It, however, was not getting the ball into the golf hole. So reliability is going to be measured by the true test score plus some measurement error. The measurement error depends on the ability of the student level, the test conditions, the examinee conditions, distractions, and other noise that is not explained by the difference in the knowledge fund of the students. You look for an internal consistency. Does each examination item contribute to the overall test score? And in the United States, an example of this is a driver's license test, where each item contributes to the ability to assess whether the student is able to drive safely on the roads. There can be a confidence interval of plus or minus a certain number of scores, and that is going to affect grading. So the factors that will influence reliability was the test adequately long to sample all the course content? And this should be greater than 60 multiple choice question items. Was there sufficient time for all examinees to finish? One of the characteristics of testing is that timed tests test performance, untimed tests test knowledge. So in the early years of medical school, we tend to give the students plenty of time to finish the examinations because we're more interested in testing their knowledge fund. When they get to the licensing examination, it will be a time test because they're more interested in determining the performance of the students. The test should have a moderate level of difficulty. That means it allows you to discriminate between the students who know the knowledge fund well from those that do not know the fund well, and the items themselves should be free of ambiguity. And then finally, the directions should be clear and concise. The student should recognize what it is they are doing. Validity is the degree to which a test measures what it is supposed to measure. So, is the examination representative of the universe of all possible items from that domain? And this is done by creating a blueprint. Does the examination provide the data that increases the accuracy of the decisions made about the examinee? And that's back to reliability and validity. And are the methods used in the assessment, do they match up with the educational objectives? So there are different types of validity. There's face validity, where it seems to be measuring what it is you're interested in. There's a content validity, where the examination is reviewed by experts, and they say, yes, it is indeed measuring what you're interested in. There's a criteria-related validity, and this is allow you to use predictive measures to see, does the examination performance allow you to predict future behaviors? And then there's a construct validity. Do you look at what the goal was and design the examination items appropriately? So going back to the golfing analogy, here is an example of a test that is valid, but not reliable. If you would take the average of all of these performances, you would end up close to the hole. However, no single performance is in the hole. What you're looking for on an examination is something that is both valid and reliable. That's where you're going to have the increased confidence in that examination. So the sum of the item reliability and validity determines how the examination is reliable or valid. The performance of all of the examinations determines whether or not the curriculum is reliable and valid. So these things feed into each other, and at the curriculum level, you should have a confidence that you've evaluated all aspects of the knowledge fund. So for the item analysis, when you break out into the small groups, you're going to be looking at two major pieces of data to try and assess the performance of the examination questions that I have just used a couple weeks ago for our students. The first of these is called a difficulty index, which is how hard was the question. It ranges anywhere from 0, meaning every student missed the question, to 100, meaning every student got the question correct. What you're looking for is a maximum discrimination between the high and the low achievers. If the difficulty is the only thing you're interested in, something greater than 90% is too easy, something less than 20% is too hard. The ideal difficulty, however, is going to vary in a multiple choice question with the number of options you present. That ideal difficulty is going to be halfway between random chance and 100%. So if you have a true-false question, a question with only 2 possible responses, the ideal random choice says about 50% of students will get that correct. The ideal difficulty is halfway between that 50% and 100%, for somewhere around 0.75. If you ask a multiple choice question with 3 possible responses, random chance says that you got about a 1/3 chance of answering it correctly. The ideal difficulty then is halfway between that 1/3 and the 100%, which puts you at about 66%. If you have 4 choices, then the random chance puts you down at about 25%. And that means that your ideal difficulty is going to be around 0.62. And most commonly, we run into questions with 5 responses. That means random chance is about 20%. And the ideal difficulty for those questions should be around 0.6, halfway between that 20% and the 100%. The second number you're going to look at in evaluating the examination is called a discrimination index. What a discrimination index does is it says, did the students who performed overall higher on this exam perform better on that item than the students who performed more poorly on the examination? If there was no difference between the performance of the two, then the discrimination was 0. That question did not discriminate based on knowledge fund. The higher positive the discrimination index gets indicates that that question did a better job of separating the students who understood the material well from the ones who did not. A negative discrimination index means that the students with a lower knowledge fund actually performed better on that question than the ones with the stronger knowledge fund. So anything with a negative discrimination index, you're going to identify as problematic. Something's wrong with that question. In looking at the big picture, it's important to realize that the examinations are used to evaluate students. The number you want to look at to figure that out is the difficulty index. However, in the item analysis, the students evaluate the examination. The number which will tell you how well that worked is the discrimination index. And you want to look at both when evaluating a multiple choice question. So those two indices do interact. The discrimination should increase as the difficulty falls. So easier questions may not discriminate. If everybody gets the question correct, its discrimination index is going to be 0. However, your harder questions should discriminate. and you need to evaluate both at the same time when evaluating the examination items. So it is difficult to construct ideal questions. The way the process works in our institution is the instructors construct items. They then use them in an examination. The examination is then subjected to an item analysis, and if the item performed well, it is added to an item bank. If the item performed poorly, then the item is reviewed, revised before and reused to see if it is suitable for adding to the item bank. So the goal is to find questions in an examination that you think are performing very well, and then you add those to the item bank for future examinations. It's important to remember that these are only guidelines. Sometimes you can decide to break the rules. I know I will incorporate humor into some of my questions. And the item analysis is only an index of reliability and validity. So in creating clinical vignettes, it's important to look at textbooks and other resources to find clinically accurate vignettes, because in our school, some of our students have clinical experience before joining the medical curriculum. And the clinical vignettes have to be accurate, or else it will create a problem for those students not related to their knowledge fund. As an example of the types of clinical scenarios you can use, here we've got a concept map for the female reproductive system. So we've got gonadotropin releasing hormone up on the top. That is going to stimulate the release of FSH and LH. The FSH is going to work on the ovarian follicles to mature them. They produce estrogen, which provides a feedback inhibition. The estrogen also prepares the uterine endometrium. The LH is going to be involved in ovulation, and then it is going to maintain the corpus luteum. Corpus luteum is going to produce progesterone, which is going to govern the endometrium secretions and inhibit uterine smooth muscle contraction. If there is a fertilization and the blastocyst implants, then the blastocyst is going to secrete human chorionic gonadotropin, HCG, which will maintain the corpus luteum. And then you can have the embryo developing, the placenta developing. With each of these numbers, these are examples of clinical cases that develop because of a problem with this exact area of the flow chart. So this is the same flow chart in a smaller level, but what you can do is you can look at the cases beginning with number 78. You can get menopause, hypothalamic amenorrhea, polycystic ovarian syndrome, endometriosis, an ectopic pregnancy, gestational diabetes, and eclampsia. These all let you test what is the basic physiology of the system, because the physiology is what guides these disease processes in the pathophysiology. So as an example, take a look at this question. Take a moment and read the question. So what's important for this question is it is not a diagnostic question. We tell them the findings are consistent with polycystic ovarian disease. What this scenario then can be used for is testing the mechanisms of the disease and the mechanisms of the symptoms. So the scenarios that the National Board use get very long and it will have all of this information in the stem of the question, and then it will ask why these different things are happening. So the other type of examination item are short answer questions. I'm not going to spend as much time talking with them today, but just for the overview, it's important to identify whether your question is closed-ended and that it requires the components that must be present to answer, or if it's open-ended, and in that case, it allows the learner much more latitude to select the topic they want to explore in their answer. Most often for physiology, we end up using the closed-ended questions because we're interested in assessing a particular aspect of the knowledge fund. So in looking at the short answer questions based on that polycystic ovarian syndrome, or you could design multiple choice questions that get to these same concepts. You could ask the students to diagram the pituitary hormones of the menstrual cycle and explain how it is altered in that patient. Or, citing the data of the case, propose one mechanism for infertility. You could ask them to describe the role of the dominant follicles in ovulation, to contrast the production of estrogen and testosterone by the ovary, and then finally to identify 2 pharmacological approaches to manage this patient. The potential short answer questions really do focus on the why and the next steps based on that clinical presentation. So that's the powerful of the short answer question. It allows you to explore more deeply the student's understanding of why something is happening, and then what are the next steps in managing that patient. So we'd like to talk about the session outcomes and the take-home messages. For the session outcomes, it's important to identify the strengths and the weaknesses of clinical scenarios for assessments. The strengths is the question aligns very closely with what medical practice is, and we are using in our school, it is a medical program, so we're preparing students for success when they get into the clerkships. It's important to craft engaging vignettes for effective clinical scenario development. And this is for instructors who do not have clinical expertise. This is the most challenging aspect of designing multiple choice questions, because the vignettes have to be clinically accurate, or else they're going to create confusion for any of your students who have clinical experience. You should be able to design insightful short answer questions if you focus on evaluating clinical knowledge in terms of the why did this occur and what are the next steps. You should be able to master the art of multiple choice question design and evaluation to assess the learning outcomes. And then finally, to apply these skills and implement practical clinical assessments. So my thanks to Professor Lamb for moderating this session, and Dr. Litt and the organizing committee for the opportunity to speak with you. I'd like to take a few moments for questions right now about the presentation, and then I'll give you instructions on the task as you move into your small groups.
Thank you very much, Prof. Carroll.
And I can see,
that was wonderful. I think it has highlighted a lot of things for us to proceed further.
very good. If you have questions, I ask you to unmute yourself, or you can type them into the chat box. I have access to the chat box.
So, Dr. Lid, do we break up now, or do we answer questions at?
We still have some time before the breakout, so Prof. Carroll
Yes.
can answer some questions related to the
Yeah,
presentation.
when the session is fresh in the participants' mind.
Yes.
Yeah. All right.
And it's important that they understand this, because the tasks in the breakout room are going to rely part on this information.
So, ladies and gentlemen, if there are any questions, you can post them onto the chat box, or you can direct the question, turn on your mic and direct the questions directly to Prof. Carroll.
Very good. Felicita, I see your hand is raised.
Right. Hi, good morning, Prof. Carroll, or good evening. Thank you for that presentation. It got me thinking about a few different things. I think my question is how, when we design the questions for the assessments, you're mapping it to the learning outcomes. And I saw, based on the analysis that we do, whether it's on the biserial point or the discrimination index, do you also assess whether they've been effective in assessing a specific learning outcome or a specific Bloom's taxonomy?
Yes. So when we break out into the small groups, you'll be tasked with both looking at them in terms of the Bloom's taxonomy, as well as the difficulty and discrimination. In terms of the Bloom's taxonomy, the questions that are purely knowledge should they should be relatively easy. A lot of the students should get that correct. The ones that test the application are the ones that are going to be more challenging. And I'll go into this when I give the instructions for the breakout groups. So I'll touch on that point with the instructions for the breakout groups.
Okay. I think my question is, so to assess whether the question is of good quality, to assess that specific Bloom's taxonomy, do we have like a method of doing that? Because I think so, in my previous practice, just to give some context, I think we were very simplistic about it. We just would look at the number of students who scored 50% or more in that question, and that would give us an idea of whether that was effective in assessing that Bloom's taxonomy. So
yes,
is that reliable, in other words?
I'm a little more stringent when I look at my questions, and you'll see I've got some that did not perform well in the breakout group. The performance, let's see. The two ways to look at the Bloom's taxonomy is aligning with your course goals. So our course, we actually do expect them to learn the information, to memorize typical values, to memorize definitions. So 1/3 of our examination items focus on knowledge. 1/3 focus on concept, and 1/3 focus on application. In contrast, our licensing examination only focuses on application. So they have a different educational outcome expectation than we have for our course, and they change their examination blueprint to match that different outcome.
Okay, thank you.
Yes.
I think there's a question in the chat box. Can I read
Yes.
out to you? Yeah.
Please.
This is from Rashida Zamin. Can you help us highlight the differences between OBA and MCQ, other than having less options in OBA?
What does the OBA acronym
I think
stand for?
OBA stands for one best answer, if I'm not mistaken.
Okay. So
I think it seems similar to single best answer.
Okay. So for our examinations, they are one best answer. Our licensing board is starting to experiment where there can be more than one choice. If you're going to have more than one choice, you've got to implement partial credit for getting some of the answers correct. And that gets into a much more complicated grading scheme. But there are guidelines for how to handle questions where which drugs can be used to treat this, and you have to select all of the drugs which would be appropriate to treat a particular disease. If you miss one of those drugs, you should get partial credit for the drugs that you did get correctly. And if you identify a drug that's not to be used for that disease, you should get negative marking for having selected a wrong answer.
Okay, I do have a question that posed directly to me. So from Kumar, thank you, Prof. Carroll, for your nice presentation. Regarding the slide on the PCOS case scenario, what is the need to provide a long scenario when the diagnosis is already provided? In still some more, in we prefer to keep the scenario short and provide only the required info. For example, a 25-year-old PCOS patient has abnormal facial hair. Which of the following explain her symptoms?
Yes. And when you look at the examination questions that I used in the renal physiology course, which is for our first year students, they follow that pattern. So I don't use the extensive vignettes for this course, but the licensing examination does. The difference is in the licensing examination, they would not tell the student that this is a patient with PCOS. So they would present the symptoms, expect the student to make the diagnosis, and then answer a question about the mechanism of the disease. So that's one difference between the outcome goals of the licensing exam group and my goals as an instructor. As an instructor, I follow the pattern much more like was described. Just a patient with heart failure or with pulmonary edema is exhibiting these symptoms.
Okay, got it. According to Kumar, thank you.
Very
Hi,
good.
Prof. Carroll. Just one question from me. It's Elena here. Just wanted to actually ask whether it is necessary for all of us to determine the validity and reliability of each individual questions after a particular assessment. Do you actually practice that in your establishment? Thank you very much.
Thank you, Alina. And yes, we do. For every question that we use, we do an item analysis, and our curriculum committee reviews those item analyses and looks for questions that have flaws in them. So yeah, there's an external review. They don't only rely on the instructors to do the review. There's a separate committee that reviews the questions. And it's allowed our examinations, our item bank, to both grow and become larger, as well as having better quality items in the examination.
Okay, thank you, Prof. So the reliability, do you actually repeat the same questions in a different cohort of students to see whether the performance is actually similar to the previous cohort, and then you determine that reliability index? Is that what you also do?
Yes, we look for the reliability in that if the question performed well, and then we use it again, we expect the question to perform well again. The item analysis is repeated, and we don't expect to find any flaws. If we find flaws with a question that had performed well earlier, we then start to become very suspicious about changes in the course, changes in the teaching. Why did that item do well for a class of students 2 years ago and not do well for the current students?
Got it. Thank you very much, Prof.
Very good. So I'd like to talk about the expectation facility. Oh, it's facilitator guide, wrong one. Let's see. So can you see a file that says April 2024 TSFP?
Yes, Prof.
Okay, good. So in looking at the questions, you'll be given a handout with 21 questions from an examination that we administered last month, a couple weeks ago. And when you look through this, the examination blueprint is going to align with the course learning outcomes. So 1/3 of the items are going to be at the knowledge level based on Bloom's taxonomy. So these will focus on facts and definitions. The difficulty index should be very high. We expect greater than 90% of students to perform on that, and the discrimination index may be low. 1/3 of the questions are going to be at the concept level. So these tend to focus on graphs, relationships, and equations. The p-value should be moderately high for these questions. That is, they're a little harder than the fact questions. And because more students miss it, the discrimination index now should be positive and greater than 0.10. 1/3 of the items are going to be at the application level. These generally focus on clinical vignettes and the use of data to draw conclusions. The p-value for these guys, these should be harder questions. As many as half of the class may miss them. But because they're harder questions, these should be expected to have a higher discrimination index. So the task that you have for the breakout session is first to review the item analysis that's provided on the next page and identify any items that you feel are flawed. The way you'll do this is you'll begin looking for items with a low p-value and then review those items for possible errors. The next step is to look for items with a negative discrimination index. You would again review those items for possible errors, and then review the items by Bloom's type and see if the performance matches the expectation for that types of questions. Then after you've gone through that, work within your group to discuss any changes you would recommend to the question or the answer key related to that question. So, and then the rest of the handout you have shows the item analysis with the questions and then the data from the item analysis there. Does everybody understand what the breakout task is? And if so, your facilitators can guide you through it. You want to split them into groups now? Dr. Litt?
Yes, okay. So we are ready to split into group. Caveat from the facilitator, we are not content experts, so we are helping to just moderate the small group discussion. So we will join back after 30 minutes and Prof. Carroll will take up the rest of the questions. I think Zubaida has another question. Probably Zubaida, we will answer the question later on after the discussion. Okay, So I will enroll everybody into the small breakout room and start to look at the handouts. Sorry, let me join. Prof, you can join any of the breakout room.
Okay, thank you.
You can join in and out. Or you
Very
want me
good.
to assign you?
Yeah, go ahead and assign me to one of the rooms.
Okay, so assign you. So, hi. Hi, Famida or John. Are you choose not to join the small breakout room? Hi, Famida. This recording will be shared in our TFSP website later. Hi, John. Are you unable to join the breakout room? Hi, Chu Ming Wong. Are you unable to join the breakout room? Hi, Dr. Das. Do you like to join the breakout room?
Yes, doc.
Okay, I'll assign you then.
Okay. Thank you.
Welcome.
Lid, I think we are all out.
Okay, would you like to share the Q&A, Prof. Lam?
Sure. Let me try and share. One topic that we did not get to in our breakout session, that other groups may not have gotten to, was looking at the Bloom's taxonomy. And a separate handout has the Bloom level. And so for a concept question, the difficulty was greater than 0.9. So this is something that the students actually understood very well. In contrast, for question 21, this is a fact type question that the students had some trouble with. So you would look at this question and go, why was this question not easier if it's testing just a fact? Were the students alerted to that fact so that they knew to pay attention to it? If a question does not perform well, the punchline for that is the students have not proven to me that they understand this material. So you don't know whether it was teaching, learning, or testing that was at fault, but the students this question did not allow the students to show me that they had mastered that information. And that is the goal for examination items, is to allow the students to prove to you that they've mastered the topic. With that, stop sharing. What questions arose in the other breakout groups that can be addressed in this larger group?
I think there was one question that came up in ours, and it was related to question 20, with regards to the volume disturbances and how the options and the distractors were, increase, decrease, intracellular volume versus extracellular volume. So one of our colleagues asked if that is still, are they still good distractors if they're merely just outlining, increase, decrease, and, the different compartments, are they still good distractors?
Sure. And for, especially in physiology, we like one thing goes up, one thing goes down, or does not change as potential outcomes for an event. So yes, having with only two choices, up or down, one space or the other space, you're limited to 4 choices. And where we usually would like to have 5 choices, there's just not a possible 5th choice for that question. So you go with the 4 choices since they're the only ones that are logically available. Our licensing exam has started using, and we're going to also start using more than 5 choices. So you could have 8 choices, and then it could be increase, decrease, did not change. So that would get you up to 6, or instead of talking about 2 things with 2 choices, it would be a 2 by 2 by 2, which would get you up to 8 possibilities. So you should have believable, plausible choices for each of your things. And if you run out at 4, you only have 4 options available for the students to select between.
Okay, thank you, Prof. Carroll.
So in the question for question number 27, it was the students were not clear between renal plasma flow and filtration fraction. So, yes, and one of the concepts that we try and emphasize with our students is the fact that clearance or most renal studies look at renal plasma flow, not renal blood flow. So the students did not make that correction as they went through and chose 12% for the answer. So that is a real, it is a teaching point and one that I feel as important. So that was question 27. And going back to the share the screen to. So the question had to do with the item number 27 for a patient with this renal blood flow and hematocrit and GFR, what is the filtration fraction? And the task in front of them was to change blood flow into renal plasma flow of about 600 mils per minute. And then that would get them the correct answer, the filtration fraction of 20%. And when you look at that item, the difficulty, so 27. Sorry for jumping around on the screen. Yes. So for question number 27, it was a challenging question, which it could be. And the students that scored well overall on the exam missed that point. So my takeaway from that is that the students did not recognize that as something that was critical for them to learn in my teaching. So I would probably use this exact question and turn it into a clicker question, an audience response question in class next year, so that if they get it wrong, it doesn't count against them, but it emphasizes the need for better understanding that question. So the examinations can be feedback to the teacher as to what was learned effectively and what was not mastered, in spite of what the instructor expected. So very good comment.
Hi, Prof. For question 22, sorry, 20, we were wondering whether because that question, the answer is actually quite obvious for following the STEM, but we were wondering why in the analysis the good students seem to score quite have quite low scores. So we were wondering whether this is a question where the good students have been overthinking.
Yes, so for question number 22, and remember.
No, sorry, no, 20.
I'm sorry, 20. For question number 20.
Yes, it's especially with the second last sentence. The friends confirmed that the patient had ingested a large volume of amount of water. So that actually would that's a giveaway answer as it were, because it's obviously it's B. But
Yes.
we noticed that the good students have been scoring not so well. So we were wondering whether the good students have been overthinking about this case.
Sure. And for this question, the good students actually selected A as their most popular answer. And our students are really focused to answer exactly the question that is being asked. So the prompt ends with the primary volume disturbance contributing to the seizures in this individual. And if they ingest water, the extracellular volume has to get diluted. Volume goes up and gets diluted first. Then the cell water volume gets expanded. So the trouble, we think, or my guess in looking at this question, is that the word primary was creating a problem for the smarter or the students who perform better. That the sequence is you ingest water, the next thing that happens is your extracellular water expands, and then only after that does the cell water expand. So the fact that we've got the word primary is we think is what I think was creating the challenge for these students. So eliminating the word primary and just going to volume disturbance contributing to the seizures, or probably directly contributing to the seizures, and then that would be the increase in intracellular volume.
The
So
other point, sorry.
Yes, Prof. Lamb?
The other thing we were thinking of, perhaps the ingestion of ecstasy has confounded the issue. Perhaps if you remove that, is because it looks as though it's not quite that relevant to this case.
Yes, but I needed a reason for why someone would ingest an abnormally large volume of water. And ecstasy does have as one of its side effects.
Is that normal behavior for people who have injected ecstasy?
Yes, it's one of the side effects. It can be a side effect for that particular drug.
Oh, okay. Thank you for that knowledge. Yeah.
And I say this only because I read this. I've got a group of nurses that also take the same exam. And they said when they work concerts that they've never seen individuals who do take ecstasy overhydrating. So they say this is not an accurate clinical scenario. And they're in our class, the nurse anesthesia students who are critical care nurses, very experienced nurses, also take the same physiology course as our medical students. So they help to backstop my knowledge about clinical medicine very often.
Do we have time for one last question, Prof. Lam?
Yeah, I guess so. Dr. Lin?
Yes, we do.
Sorry, Prof. Carroll. So I was just looking at how in the list of questions, a lot of the application questions had not a very high discriminatory index, and then there's the fact question had one of the highest discriminatory index. I found that interesting because I always thought that concept questions and application questions usually would eliminate the strength of the strong students, or higher performing students compared to the low performing students, or concept and application questions would logically, I thought it would have a higher discriminatory index. But in this case, the fact question had the higher discriminatory index compared to most of the concept or application questions. Do you have any thoughts on that?
Sure. And that, unfortunately, is one of the characteristics of our students. The stronger students, the ones that perform well, try to memorize their way through everything, and they're very good at it. So the questions, a lot of them can be puzzled out through pure memorization of facts. Things that we think are testing application, memorization can get to it. And in getting ready for this exam or for this seminar, I ran all of these, not the questions I wrote for the exam, but the ones I used in the seminar through the artificial intelligence, and it answered all of them correctly. So the being able to, I think you have to go to the more complex questions before it's going to be able to answer them correctly that involve a relatively long clinical stem where the students have to make a conclusion about a diagnosis and then a question about mechanism of disease before something like the AI programs do not immediately identify the right answer. The other aspect is the questions that I used in my in the talk came directly from the national board, and they published those. So those are part of the World Wide Web, and you can find the answers to those questions on the web because they are published by our licensing group as practice questions for students. So I'm not sure that it's always using logic, but the answers are a little too tight to be spontaneously generated. I think somebody wrote them and the program just harvested their answer and spit it out again when it was given the same prompt.
Okay. Okay. Thanks, Prof. Carroll.
Do you have any further questions?
I think Kumar has posted a question in the chat.
Okay. Share the perspective on using AI as a tool to construct questions for the examination. And yes, I've gone that route also, and it is very good. I asked it to create 10 renal physiology questions written in the style of the national board, the USMLE style questions. And it came out with 10 quality questions. They weren't completely correct, but as you're looking for ideas for how this information can be tested, the AI gives you a really good framework. The only caution that I will use is it still makes up stuff completely. I asked it to put together a symposia on the use of AI in teaching physiology. And it put as a symposia proposal, and it put together a wonderful symposia proposal. The only trouble was all 5 of the individuals it recommended and provided their biographies for don't exist. So it just made up people with the characteristics of someone who would be an expert and said, okay, Dr. So-and-so from Harvard is a world leader in this and can address this issue. And I went to the website and that person doesn't exist. So you have to be cautious with what it gives you. It will give you an answer, but much like spell check on a document, if you misspell a word, but the word is actually another word, it won't pick up the error. It'll just say, no, that word's correctly spelled, even though it's not the word you were intending to use. So, yeah, we have no idea how AI is going to play out in terms of both teaching and learning, but it's going to be a reality. Well, the conclusion and the reason that I shared the data from my most recent exam was to first to encourage you to experiment with your item writing and recognize that all experiments don't work well. You're going to write some questions that don't perform well, and it gives you an opportunity to look at them and to see what combination of teaching, learning, or testing was responsible for that item not performing well. And that can give you good insights both to your teaching as well as to how the students are identifying what material they feel is important to learn for the examinations.
Okay, if you do not have any further questions, probably I invite Prof. Lam. Okay, we do have one last question.
Krishna put one in the chat. The question in our small group, can you ask questions on information that was not covered in lectures and slides? And I tell my students, yes, that 10% of my examination questions will be on things that were not covered in class. But if they have learned the concept well, they should be able to apply the concept to a new situation. And this ecstasy question is an example of that. We did not talk about that in class, but they should be able to draw the conclusion appropriately if they understand that the cell swelling and that the brain is particularly susceptible to swelling inducing seizures. So I'm very open with my students about that. And we do a lot of in-class activities where I show them how to approach something they've never seen before and to rely on the information they already have in order to draw correct conclusions, because we cannot teach them everything. We're there to teach them the concepts and the processes that they're going to use to analyze information when it's presented to them.
I have a question follow up from that. So here we do have course learning outcome and also our course objective. So in terms of writing the questions, we usually refer back to the course learning objective and the lecture's outcome. So it is, I guess it is all right to ask something out from our course learning outcome?
No, for our course learning outcomes, we have be able to interpret data from a clinical scenario to identify the disturbance and the mechanism for the disturbance. So we don't say what particular disturbance or things, but take the information and apply it to a novel setting is one of our course outcomes. And in contrast to, can you ask things that are not on your course outcomes? Absolutely not. Every question we map to our course outcomes, and I tell the students when I write my questions, I do not have the book in front of me. I do not have my lecture notes in front of me. I only have the course outcomes in front of me when I'm writing my questions. Another question in the chat is, do you analyze other type of examination question than multiple choice questions? Because our licensing exam uses exclusively multiple choice questions, no, we do not use those for courses that are fact or knowledge based. We do use essays and projects for the ethics courses, for courses that are testing the behaviors, but not for the courses that are on the knowledge and concept side of our curriculum. The short answer questions, I've served as an external examiner for the university down in Jamaica, which uses, they're part of the UK model of teaching where they use a lot of short answers. And the way they use quality control is they have another outside set of eyes come and look at the marking that the original instructor did on that question and see if they agree with that marking. But it's very hard to get a good quantitative read on short answer questions.
Okay, probably that's the last questions that we have. We just left it 2 minutes to 11. Thank you. I'll take this opportunity to thank Prof. Carroll. Probably Prof. Lam would like to do the closing.
Thank you very much, Prof. Carroll. So as we come to the end of this webinar, we would like to thank all of you, the participants, and Prof. Carroll for coming in and spending this Thursday morning with us here in this part of the world. And to you, Prof. Carroll, thank you once again for giving up your evening to spend time with us. So with that, I think it was a wonderful session. It was very valuable. I think we learned a lot. And I think we also learned somewhat a bit during our break session. That was a good session. It's a good way of conducting this webinar. And so with that, I think we bid you farewell. And thank you once again.
Very good. Terima kasih, Prof. Lam.
Thank you, Prof. Very much.
We hope to see you in this part of the world sometime in the future.
Thank you
So
very
that we
much.
can meet face to face in person.
I would enjoy that also. Hopefully it will happen.
Bye.
Bye-bye.
Bye-bye. Thank you very much, Prof.
Bye, everyone.
Thank you for
Thank you,
joining.
everyone.
Thank you.
Thank you for joining.
Bye-bye.
Yeah.
Thank you.
Echo that. Thank you very much for joining.